Welcome to Healthy Food Action's 4-part webinar series on food pollution, what clinicians and parents need to know. Today's webinar is on heavy metals in the food supply. I'm David Wallinga, Director of Healthy Food Action, which is a 3-year-old network that engages American health professionals around issues in food and farm systems and helps them to advocate for policies to create a healthier future. Making sure the webinar runs smoothly today is my colleague Rachel Gruhl. We want to acknowledge our co-sponsors, the Alliance of Nurses for a Healthy Environment at envirn.org and Safer Chemicals Healthy Families. The moderator of today's call is Paige Tomaselli. Paige is Senior Staff Attorney at the Center for Food Safety, where she works on law and policy issues from factory farming to genetically engineered crops, from organic food standards to arsenic in chicken feed. Paige holds a JD degree from the Vermont Law School, and she's also the author of this month's blog on healthyfoodaction.org, which is called Arsenic, It's What's for Dinner. After the speakers today, Paige may comment a little bit on some of the policy context around arsenic and what the Center for Food Safety is doing. And now to introduce the other speakers, let's hear from Paige herself.
Thank you, David. Our first speaker today is Urvashi Rangan. She's a toxicologist with a doctorate in environmental health sciences from Johns Hopkins University. She directs the Food Safety and Sustainability Center at Consumer Reports, which has more than 7 million subscribers. Dr. Rangan oversees all of the center's safety testing projects and risk assessments, also serving as the chief spokesperson to the public, translating the often complex science into actionable advice for consumers, as well as recommendations for policymakers. Ann Carroll and Art McCabe will join us to do the second presentation. Both work on cleaning up brownfield sites, which are often contaminated with arsenic and other metals, and which often end up in food production. With a background in public health, Ann has worked with EPA's Office of Brownfields and Land Revitalization since 2002, expanding that Superfund program's scope to look at the public health benefits of brownfields cleanup. Before joining EPA, she worked at the Office of Technology Assessment, which Congress abolished in the early 1990s, and at the National Governors Association. Art was a lawyer in private practice for 35 years before joining city government. He now manages community development for Lawrence, Massachusetts. He runs the Safe and Successful Youth Initiative, a state-funded program that recognizes youth violence is at heart a health issue resulting from the cumulative acute health disparities. Art will talk about how brownfields remediation and building community gardens besides health, are tools for engaging and stabilizing neighborhoods. Now we'll talk about some logistics. We'll be gathering your questions during the presentation for the 20-minute question and answer period at the end. Please submit any questions at any time during the webinar. The earlier, the better. Use the right-hand menu on your screen. Look for the box labeled Enter Question for Staff, type it, and hit Send. And now for our first presenter. Dr. Rangan, please let Rachel know when to advance your slides.
Okay, great. Thanks so much, Paige. I appreciate it. Well, hi, everybody. Welcome. As Paige already said, my name is Urvashi, and I've been here at Consumer Reports about 15 years, doing a lot from food testing to advocacy and making sort of recommendations for how we'd like to see marketplace improvements. I'm sure a lot of you are familiar with Consumer Reports, but maybe what you don't know is that we do a lot of advocacy work and testing to also get the marketplace improvements we want to see. So I'm here today to talk to you about arsenic exposure from food. We, along with a lot of other groups, have been very interested in this topic for some time, and arsenic is really one of the most potent carcinogens out there, and in the last 18 months we've actually done 2 major food testing studies on arsenic and learned a lot about it, have a lot of recommendations that we've made, and there's definitely been some inroads made as well on arsenic with regard to food supply and how we are dealing with things. So I'm here today to really talk to you about how arsenic gets into food, why we should even care about it, and what are steps that consumers can take to reduce their exposure. And I'm also going to talk a little bit about some of the longer-term solutions that we see are necessary so that consumers don't always hold the onus of navigating their way through this problem. Next slide, please. Great. So, what is arsenic? And if you've listened to the media, you might have heard drips and drabs. And it's most of the time right. Sometimes it's not right. So we thought we'd just give a quick primer on what arsenic is. It is a metalloid that is found in the Earth's crust, and you will often hear that arsenic is a naturally occurring metal. That is true. But there are geographical differences in arsenic levels, and not every place has the same amount of arsenic. The USGS, the U.S. Geological Survey, actually has a pretty nice map of arsenic concentrations in the United States and where the hot spots are. And if you live in the Northeast, for example, and you have well water, it's definitely something you want to take note of. There are places in this country where arsenic in water can be particularly high, and in those cases we definitely advise people to test their water, especially if you're on well water, for arsenic. But in some places like New Jersey, they are typically very low in arsenic, and their drinking water standard is actually among the lowest in the country. And so depending on where you are, those arsenic levels in the environment can be quite different. There are basically two families of arsenic, if you will. There's the inorganic family, and these are chemistry families, and the organic family. And organic shouldn't be confused with the USDA National Organic Program. It's organic chemistry, so we're talking about something altogether different. Organic chemicals in general are linked to carbon molecules. That's what makes them organic. But what's really important here is that the family of inorganic arsenic, those compounds are potent and known human carcinogens. We've known about its skin carcinogenicity for some time, but lung and bladder in the last decade have really come to the fore, and they're more sensitive endpoints. And even kidney and some other cancers are now being looked at as also potential carcinogenic effects of inorganic arsenic. There is also a family of organic forms of arsenic, and there's lots of different types in there. And arsenobutane is the type you typically hear about in fish, and that is the type we are the least concerned about. But there are forms of organic arsenic, DMA and MMA, as you see in the second to the last bullet point here, where those are considered probable carcinogens and classified that way by IARC, which is the International Agency for Research on Cancer. So we are concerned not only with the inorganic forms, but also with some of these organic forms. And for any of those of you who understand metabolism, the metabolism of inorganic arsenic will also generate organic multivalent types of metabolites, and even those are thought to be quite toxic, in some cases even more so than the inorganic forms. So we're still learning a lot about the toxicity of arsenic, and we're still nailing that down. At this point, we are able to really do quantified risk assessments on the inorganic arsenic forms. The science isn't there yet, and we don't have quantification for the other forms, as well as the other toxicities of arsenic. And before we leave this slide, just to talk about the fact that there is a lot of research going on around the country, especially looking at offspring of women or animals that are being exposed to arsenic, and looking at some of the non-cancer risks. Those tend to be the immunotoxic effects, and they are serious. And so those things are still being studied now, and it remains to be seen exactly how we quantify that. But that should be on everyone's radar as potentially problematic. I'll take the next slide, please. Okay, so, how arsenic gets into our food. We've talked a little bit about Mother Nature. So arsenic is there in the earth. It's in the Earth's crust. It's in some water, and as we mentioned, that can lead to contamination in certain places, and if we choose to grow things in those places that have high arsenic levels available up at the top levels of the soil, that can also be problematic as well. But there are things that we do that move arsenic around, and one of those things that you see on here is the use of pesticides. For decades, we were using a very toxic pesticide that included inorganic arsenic called lead arsenate, so it had lead and arsenic, and those were used on rice fields, cotton fields, really all over. That particular pesticide is not allowed to be used today in this country, but we do still allow organic arsenic pesticides out there, and while they're not used directly on food crops, they are widely used on cotton, on freeway rights-of-ways, sod farms. And we, in that way, are essentially adding arsenic into our sort of food system at that top level by using these pesticides, which can sort of compound contamination into our soil and in our water. We also have, and what you don't see on this chart, we have for a long time allowed arsenical drugs to be fed to poultry, and we use the manure from that poultry as fertilizers to fertilize food, and that can also lead to problems in terms of spreading arsenic around, and certainly water, as we've talked about, if it's high in arsenic, can also be problematic when it comes to agriculture. And you know, in the south central United States, we grow, I think, about 80% of our rice in this country, and that part of the United States was heavy into cotton farming, was also heavy into poultry farming, and as a result, there's a lot of arsenic in that area, and it may be that there's some that's naturally occurring. Whatever it is, the levels in those areas are particularly high, so high, in fact, that at one point in time, the types of rices that they were growing in that region of the country were becoming diseased from the arsenic itself, and they were getting a disease called straight-head disease in the rice plants that they were planting. USDA actually set up a research shop down there to help them look at different varieties of arsenic that could survive and tolerate those levels. I mean, different varieties of rice that could survive and tolerate those arsenic levels. In our tests, when we looked at rices from that part of the country, on the whole, those rices tended to be much higher in arsenic levels than other rices that we looked at. That doesn't mean you can't have high arsenic rice in other places, but again, the fact that we know what the geographical sort of profile of arsenic is there, as well as noting those high levels, was definitely concerning. And I'll talk a little bit more about how we brought that to the attention of the USDA, and while the uptake of arsenic was not on their radar, I think it is now, and they are now doing research to look at arsenic levels in the rices that they're growing and different agricultural practices that may affect it. Just quickly off of this slide, one other thing that we wanted to do in our studies in looking at how arsenic was getting into the food chain and knowing that it was getting into food was wondering, well, okay, it's in the food, but are people actually being exposed to it? I mean, you can make a logical assumption there, but we also had data from the government called NHANES, which is a big database, nutritional database done by CDC every year, and when you look at that database, we could see that people who had eaten rice in the 24 hours prior to the samples being tested had 44% higher levels of arsenic in their urine compared to those who hadn't eaten rice. So it was important for us to also look at the actual exposures in relationship as we were reporting out that study. Okay, next slide, please. Thanks. So we've talked about arsenic in water a little bit, and this is one area where globally we've really taken a lot of action. We're concerned around the globe about exposure to arsenic in water. Arsenic in water tends to be almost all inorganic. It's just sort of the way it is in water, and very bioavailable for those of you who understand that term, but it can be easily absorbed by the body and metabolized. And the U.S. actually lowered its drinking water standard in water from 50 parts per billion to 10 parts per billion in this last decade. Interestingly, EPA had proposed to drop it to 5 parts per billion, but because of economics, they came out and netted out at about 10. So 10 is not a line of safety, nor is 5 really a line of safe or not safe, but these are, of course, ways in which we get to better protect public health over time and try to get safer and safer. Ideally, with any carcinogen, the answer is no amount of carcinogen is safe, and mitigating your exposure as best you can, especially for kids, is really important. So we knew that arsenic regulations in water were a big focus, and one thing we were perplexed by, and so have been a number of other groups, is why don't we have these same standards in food? We don't really have any standards for arsenic in food, and that was one of our bigger recommendations that came out of our test projects, and other folks who are on this webinar have also been pushing for standards to be set in food. So let's talk about that. Next slide, please. Okay, so when we were interested in looking at arsenic in food, we actually, we start with looking at FDA's data in what they call their Total Diet Study, or TDS, and FDA's been doing this since 1991, essentially. It's actually very interesting. It's primarily on ready-to-eat food, so everything is cooked in there, but it gives you at least a good bird's eye view of what's happening across different food products. Although in some cases they're doing chicken fried rice, and so it's hard to tease out exactly why something might be present in a multi-composite food like that. But they have things like baby apple juice, regular apple juice, cooked rice, fish, chicken, poultry. So you can see really across the board. You can look at pesticides, you can look at heavy metals individually, arsenic, lead, mercury, and it has a lot of rich data in it. The one limitation of the TDS till now with regard to arsenic has been that it's typically looked at total arsenic, so that would be the sum of the inorganic and organic portions of it. And as we talked about before, inorganic arsenic is definitely the one we know has the most potency with regard to carcinogenicity, and the one that's quantified the best. Whereas the organic forms are less so. And so understanding the ratios that you have of inorganic to organic and what types of organic arsenic you might have in these different foods is important to understand the risk profile of all of those things as well. So when you take a look at that list, one thing you see is fish, and you'll start to see very high arsenic levels when you look at that. But to be careful, that is the arsenic that is the least concern to us. It's arsenobutane, and so we take fish out when we look at it. And we did that, by the way, also when we looked at exposure data in the government database. We just simply took out anyone who had eaten fish in the day before because we didn't want that to confound the results. The next food item that kind of pops to the top of the list in terms of arsenic levels is rice. And again, rice was something that we looked at. We actually looked at that second to apple juice, and we did that because apple juice, pear juice, grape juice were things that we knew children were probably consuming a lot of. And so as we choose projects, we look at things like where might the widest exposure be, and looking at vulnerable populations. So we actually had taken a look at apple, pear, and grape juice, or not pear, just apple and grape first, and then we went to rice. But to take you down this list, rice has inorganic and organic arsenic, and as we talked about before, things like water, fertilizers, and soil can all impact those levels. Rice is unusual as a food crop in that it grows in anaerobic conditions, or conditions that don't use oxygen. When you flood the rice fields, the roots are essentially in an anaerobic state, and it's a rhizome that's actually transporting nutrients and other things between the plant and the water. And so rice is very unusual. If there is arsenic in the environment, rice will take it up. It likes to take it up. But there are interesting practices that we've learned in the past year from the rice industry after we've gone out with all of this work. We're flooding fields, and the timing of flooding and all of those things can actually impact the uptake of arsenic into rice. And so I think that's really encouraging, because we did see such wide variability of arsenic levels in rice. It certainly seems like some people or some companies are getting to lower levels. You know, the question is what's going on in those places, and how are they able to have lower levels. And certainly part of it is what's in the background, but agricultural practices matter too. In chicken and poultry, there is, as we talked about, poultry has been fed arsenical drugs for some time. It's used to prevent disease and to promote growth in similar ways that antibiotics have been used for a long time. And we have been against that practice for some time, along again with almost all the groups on this webinar. And just this year, actually, 3 of the 4 arsenical drugs for poultry that were approved have now been banned. And so there's only one type of drug called nitrazone that is still on the market. We want it to come off the market entirely, but that will go a long way to stopping the cycling of arsenic through poultry, through their fertilizer. And then interestingly, poultry houses can use rice hulls as bedding material, so you can get a sense of how we're literally cycling around the arsenic. The hulls of the rice actually contain the most amount of arsenic, and those hulls can also be used in animal feed as well. So there's lots of ways in which we simply keep cycling the stuff around, and really those are things we don't need to be doing at all. In apple, pear, and grape juice, those juices tend to mostly have inorganic arsenic, and those tend to be, we think, from old pesticide use for the most part. It's stuff that's just still in the ground, and again, there may be agricultural practices that make that more or less available depending on the season, but with no one looking and no quality controls and no standards in place, it is difficult to have an industry obligated to look at those things. And so we've been demanding standards now for quite some time with the FDA around all of these foods that can be risky in terms of their arsenic levels. And just this year, an action level was set for apple juice, or at least it was proposed. They proposed it at 10 parts per billion. We think it should be 3. But you can go online and see our very detailed comments about their entire risk assessment and why we think they need to get to a lot lower than 10 in apple juice. Okay, I'll take the next slide, please. So what we tested and found, we looked at apple and grape juice. A year later, we looked at rice products. As I mentioned, we found variable levels in both, or in all of them. But really, there were some that were very, very concerning in terms of the amounts of arsenic that they had. And we did conduct very comprehensive risk assessments, again, based on only the inorganic portion, because that's all we could quantify on. And in that way, it's somewhat of an underestimate. We're not looking at other forms that may be carcinogenic. We're not looking at non-cancer effects. But simply based on that, we could even delineate really significant risk levels. And for those that understand, we actually, in our rice story, took a moderate risk tolerance for adults. We accepted a 1 in 10,000 risk tolerance. That's quite high. You're trying to aim for somewhere of no more than 1 excess cancer in 1 million people. Ideally for a carcinogen, that's what we call negligible cancer risk. So that's obviously several magnitudes of order higher. For children, we took a slightly stricter approach. We looked at a risk tolerance of 1 in 100,000. for children. And part of our strategy is, as I mentioned earlier, to provide short-term solutions for consumers, but also what are those longer-term solutions that need to be put into place. Because at the end of the day, it isn't individuals in the public that should have to navigate their way through this risk problem. It's industries that need to get a better handle on what's going on, and really regulations that would require them to make sure that they are not exceeding levels so that we can better protect public health. Next slide, please. So this is an example of what you'll find, and if you go online at consumerreports.org, you can read all of these stories in their entirety, but I wanted to pull this out because this was really a digest of a lot of work, and all of these surveys that you're seeing written here are really underwritten by individual risk assessments that we conducted for every single commodity here. What you'll see is that we did one for children. We, as I said, at a 1 in 100,000 risk tolerance area, and we did one for adults. In general, we're trying to give sort of servings per week where you don't exceed those risk tolerances. In the case of children, where we made one statement about avoiding was in rice milk. And that's just like the UK Food Safety Agency. They recommend that children under the age of 5 don't drink rice milk because of the concerns of arsenic levels in the rice milk. And infant cereal as well, just to point that out, really important. Again, for kids, I know rice cereal is a first food for a lot of kids. It doesn't need to be. I mean, certainly for some children that are having a lot of issues, it might be a necessity initially, but for a lot of kids, you can pretty much either start or not start with rice, and there are other grains like oatmeal and multigrain and even wheat that are all on the whole lower in arsenic than rice is, and so it doesn't need to be the first food that you keep them on for a long time. But even ready-to-eat cereal, you can see that there's definitely limitations. I mean, Rice Krispie treat, whatever it is, Rice Krispies, 1.5 servings a week for kids is about what we came up with. And so this was a way at least to give consumers some kind of advice in the short term while we worked on getting some of the longer term solutions in place. Next slide, please. So our advice for the public around a lot of these things were that, you know, infants and children and by default pregnant women are more vulnerable to the effects of arsenic. And we know that both for cancer but as well as for non-cancer risk. And again, we didn't quantify based on non-cancer risks, but the young people are definitely more vulnerable to the non-cancer effects as well. We don't think kids under the age of 5 should be drinking rice milk, and there's other ways to get those nutrients besides that fortified rice milk. And we think that kids should really vary their grains early, and we've seen the FDA even come out with the same kind of advice. It's a little bit buried in their website, but they're saying similar things in terms of grain diversification. In terms of consumption of juice, you know, this is one of those things that juice is not a necessary food nutrient for anybody really to drink, and we think that kids really ought to follow the AAP's advice around consumption. I think it's 4 to 6 ounces for kids up to the age of 8 and 8 to 12 ounces for 8 to 18. And that's fine enough, and diversifying your juice, again, is probably really important. I'll tell you that the grape juice was higher than the apple juice we tested. Pear juice was also, when we look at FDA's data, higher than apple on the whole. And so while the FDA's come up with an action level for apple juice, we really hope that they're going to do that for other juices that are subject to these same issues with arsenic. We've talked about the rice consumption on the previous page, and talked about the fact that if you want to buy chicken that you know was not fed any arsenical drug, organic poultry can be one of your tickets to that. There are other labels like animal welfare approved that also don't allow those. American grass-fed approved is also another label you can look for on meat that would not allow arsenic drugs to be administered. And, you know, at the end of the day, cancer risk is really hard to talk about when it comes to food, and we're trying to open up that dialogue with the public a little bit more. And part of it is about helping people understand that there's, you know, you don't need to hit the panic button with this stuff. What you do today and changes that you make today can make a difference for tomorrow. If you raised your kids on rice cereal, which I know I did, you don't need to fret and fret and fret, but making those changes today is important. Cancer risk is about exposure daily over a lifetime, and so reducing exposure, however you do it, reduces risk. And it doesn't always have to be an all or nothing thing, but understanding the paradigm that if you moderate consumption, you are doing something to reduce your risk, and that's important. I cannot remember if this last slide is
Urvashi?
Yes.
Urvashi, can you wrap up a little bit, and then we're going to move on to the next?
Yeah, I think I'm done. Thank you.
Great.
All right, thank you, Urvashi. Now we will move on to Ann.
Thank you, and greetings to everybody participating from whatever weather state you're in. Thanks for having me today. I just wanted to really echo that prevention message. And so what the Brownfields program is doing is really trying to provide grants to state and local governments, tribes, and local entities to help them assess and clean properties. And since 2008, there's been this huge increase in interest in taking over vacant properties and structures to essentially improve food access and create a local system even in urban settings. And so that's where we have gotten involved. Next slide, please. So as a background, for those of you who don't know anything about brownfields, it's real property, the expansion, redevelopment, or reuse of which may be complicated by the presence or potential presence of a hazardous substance, pollutant, or contaminant, which makes sense in, you know, industrial core areas and areas where older buildings, whether abandoned or vacant lots, occur, because frequently, you know, if there's an abandoned building or there's a vacant lot, it's because something that was there was torn down, and hopefully safely, but not always. And so that's where the Brownfields program really has helped communities take these areas and clean them up and put them into safer use. And as in many underserved areas, food is an issue, and so local food production has been an answer to food deserts in a number of areas, and so that's really where the Brownfields program has started getting involved. Next slide, please. Nope, back to the last one. And so we've obviously heard a lot about arsenic, possibly more than we all want to know sometimes. But that isn't the only contaminant that's out there in the urban and you know, regional and rural space, because we've used a lot of different things in different industries and in consumer use that now can pose risks, particularly to growers, those preparing gardens, and then possibly the food as well. And so those are all the kinds of exposures that we want to be learning more about and preventing exposures that are going to cause health risks. So paint, obviously there's a lot more recognition and understanding about lead paint and lead paint hazards in urban areas and near older housing stock and some lead industry. But there are other contaminants, whether it's from the arsenic that was used for treated lumber for a period of time, or arsenic using industries, as well as other things that I just highlight there. And by the way, there's a larger slide stack that's also in the resource materials if you want to learn more about brownfields. Next slide, please. So not only do we want communities to be thinking about kind of going forward, how are we thinking about kind of community gardens, urban ag, locations, and farms, going forward as land use planning, but also do we need to look at historical gardens, because you know, the science wasn't then what it is now, and there might not have been the attention to these issues that there is now. And so this is one of our cautionary tales. It was a garden that had been operating for over 30 years, and when a portion of the garden was proposed for residential housing, obviously the gardeners were very upset, but for that kind of change of use to occur, testing was required. And when that happened, there was a recognition that lead, polycyclic aromatic hydrocarbons, or PAHs, a combustion product, and pesticides were above the California levels. So here's an operating garden for many years, and these levels are being found, obviously very distressing for the gardeners. So EPA Brownfields grants helped assess and do that sampling, but also in the cleanup of that grant, the cleanup of that property. So between 24 and 40 inches of soil were removed at different locations, and it cost about $400,000. I guess the good news story was that as a result of that cleanup and redevelopment, there were new facilities added for older gardeners and people that had disabilities to access the garden and to have raised beds. So I guess that's an extreme looking for a silver lining. But the point is that Brownfields grants might be something that older industrial core areas might want to think about applying for to assess historical gardening areas if this hasn't been an issue that you've paid attention to before now. Next slide, please. And nope, back, there you go. And so a little bit tongue-in-cheek and as a devil's advocate, I want to propose that we think about putting all of our urban agriculture on formerly contaminated land, mostly because the environmental protection and public health folks that work on these kinds of projects are paying attention to the contamination in the first instance. And so they will try and find what's there, and they will try and clean it up or reduce exposures to it. And this is a great example of a very successful urban farm that was on a former emergency response or removal site. And essentially, nothing is grown in the soil on the site. What contamination was removed, the rest was capped, and there was 5 foot of gravel that was put on top of it. So there is no contact with that. On the other hand, this is now revitalizing that neighborhood, earning $800,000, and really capturing a community that was underserved in new opportunities for food. Next slide, please. So if you're in Philadelphia for the flower show, I encourage you to go to Greensboro Farm. So what are the solutions? For those of you who are healthcare leaders and looking at this or involved in food policy councils or other ways, dialogues about food, look for an urban property that's already been tested and is safe for growing. Or look at inventories of state or local brownfields programs, because they'll be telling you what has already been assessed and cleaned or what is in the process of being assessed or cleaned now. And if there aren't any of those around, then you should think about encouraging your local government to apply for a brownfield grant. We give about $70 million a year in competitive grants, so it's never too early to be thinking about whether this fits with your community. Next slide, please. You can also ask us directly or our state and tribal program organizers and colleagues, because we and the EPA and they do this thing called technical brownfields assistance, which we send our contractors out to provide community assistance. So that's another option. So there are these are just some urban ag handbooks that you can find from the EPA Brownfields webpage. And I guess the key point, really echoing what Urvashi said, is there is a risk of exposure, but there are other things that we really want to talk about, which are the benefits of taking those vacant properties and turning them into a safe reuse. And so I'll turn the mic over to my colleague Art McCabe from the City of Lawrence, who's going to talk about some of the work they're doing on brownfields for urban ag. Thank you.
My name is Art McCabe. Hi, my name is Art McCabe, and I'm really glad to be here today, too. I manage the Community Development Department in Lawrence. Now, Lawrence is a very, very poor city. It's about 80,000 people. It's a classic mill town. It's an immigrant city. We have a lot of old housing stock. Heavy metals are a widespread problem in the city, but so are all other forms of urban health problems, like diabetes, violence, cancer. I mean, just across the board. The community development department that I run actually has a working relationship with virtually all of the community and faith-based organizations in the city, and the police department, and the public service organizations, and most important, the Regional Family Health Center, which has a headquarters in the city. One of the things that I'm pushing today with my audience today is that the EPA and their Brownfield grant has been a critical part of our ability to access service to the poor and generally unserved population with regard to some of these health issues. Next slide, please. As I mentioned, we're one of the poorest cities in the country, in New England for sure. 78% of our population Latino, 50% of it has English as a second language, 40% are foreign-born. Many of them have, lack really working skills or any ability to get access to service. And we have to find a way to not only address the problems raised by the heavy metals, but all of the other problems in an effective way, because most of the organizations that we deal with are overworked, they're understaffed, underfunded, so they don't really have the ability to make the extra effort to get into the poorest of the poor communities. So leverage and collaboration is a key part of what we have to do. Next slide, please. That's just a graphic of our city. The green part is all of those census tracts are 50% below poverty level. So throughout our city, we're plagued with a variety of these problems. Next slide, please. The poorest area in our city is in the upper part of the graph that you see there in red. By every measure, this center is the most densely populated, and by every measure, an environmental justice neighborhood. So it has the variety of all of the issues, including heavy metals. Next slide, please. Because we've been blessed by such a vast amount of good community-based organizations, service organizations, dedicated people, we had to find a way to encourage collaboration and facilitate access to the poorest of the poor. We have all the building blocks. The missing element in our city is how do we achieve a quality of life and engage our constituency, many of whom are foreign-born and not engaged right now. Next slide, please. I forgot to mention the last slide. We found urban agriculture is a phenomenally good tool for accomplishing a lot of that collaboration that I'm seeking. Now, this graph is, just a representation of Lawrence as I see it. We have approximately 80,000 people. 10% of them have no appreciable risk factors. Another 20,000 of them have, some risk factors, but they're basically going to be okay. 40,000 of our population lives at risk and lives in poverty and has limited access to service. But the proven risk category, can you go to the next slide, please? The proven risk people are the hardest people to get because they've generally not been engaged. They don't trust government. Many of them have been involved in the criminal justice system because either through a family member or directly. They're surrounded by violence and all forms of other trauma. There's instability in the family, transient populations. They don't trust government. They don't trust the police. And they're the ones that suffer all of the chronic health issues, including the threats from heavy metals. So this is a population that we try very hard to serve, and we found urban agriculture is a good way to do it. Next slide, please. I'm going to show you a couple of slides of before and after scenes in the poorest part of our neighborhoods. And the process with this site that I'm going to talk about, but all of the other sites, has been pretty effective. Typically, when a government agency comes in to a neighborhood like this and says, "Hey, we're going to build something for you. We're going to give you a park," there's great skepticism. There's lack of trust. And most of the parks and the vacant lots in the city are basically crime and trash magnets and health threats right now. So there's a great skepticism about the area. But in the lots that I'm going to show you, we went in and made a concerted effort to talk with the neighbors, even though they initially didn't want to talk to us and were opposed to it, talk to them about the process, get them involved in the planning of the garden, and then eventually with the goal of creating a stewardship in a neighborhood. And it served as a particularly effective neighborhood stabilization and organizing device. Next slide, please. This is the before. The one you're looking at right now is the before, and this is the community garden we made afterwards. Next slide, please. I think this is an after picture. Go to the next slide. That's a before and after picture. Now these neighborhoods have classic nutritional issues. They don't have access to fresh vegetables. They don't really have access in the local bodegas to healthy foods. So they have all of the health-related diets. So if we can find a way to engage them and talk about not only the nutritional components and the threats of heavy metals, but all the other health issues that are confronting them, they become interested and engaged. Next picture, please. We also had an alleyway cleanup program where we engaged the neighbors in cleaning up. Being an old mill city, we have lots of vacant alleyways that nobody takes credit for. So we got a lot of community engagement in cleaning up some of the alleys and making them into gardens. Next picture, please. Oops, back slide. And particularly being an immigrant population, a lot of people bring to this country a love of agriculture and a lot of love of gardening. Most come from rural environments. They're used to gardening. It's a common language, and it brings people together. So this is one of the alleyways that we reclaimed and now have basically run by the local neighbors. Go ahead, next. Again, gardening is the universal language, a timeless language, and it's the common denominator. Next slide. One of the things that I want to mention, about 2 years ago, we got a grant from the state to address youth violence. It's called the Safe and Successful Youth Initiative. And it targets this this chronic proven risk population that it talks about. And the way it targets them is we establish street workers that actually go into the neighborhoods on a permanent presence. And although the goal is to target and eliminate youth violence, once we identify a youth who's involved with violence, we have a chance to go into the entire family and deal with whatever issues are there. So the street workers and caseworkers have actually developed a trusting relationship with the people in the neighbors. Through that trusting relationship, we've actually brought in doctors from our family health center who are by piggyback, get the trust that we've established with the neighbors and get a chance to talk to neighbors about a lot of the variety of issues. So they're accepted as part of the team as opposed to just periodically coming in. And it helps the family health center because otherwise they wouldn't have the ability to engage with this population, even though that's their objective. Next slide, please. So urban agriculture and urban garden in a particularly poor area, it's something that once we build it, it's there. It's where young and old can come together. It's a meeting place so that the social service agencies can actually go into the neighborhoods and have a place where there's already a congregation of neighbors that have developed some kind of a rapport with one another and with the outside agencies. So we are very, very strong advocates of using community gardens and urban agriculture as a means of engaging the poorest of the poor. Next slide, please. Thank you. I'd love to talk to any one of you after this is over about some of the problems in your cities.
All right, great. Thank you, Art, and thank you all of the presenters. In a minute, we're going to get to the questions, which there are a bunch of them. So if you have a question, you haven't gotten it in, please get it in now. And I want you to know that we're also going to go a few minutes over for Q&A. So if you can stay, please do. If not, listen to the recording to hear the great questions. And I just wanted to give you a really brief summary of victory in arsenic. Arsenic's an issue that's near and dear to my heart. And Urvashi gave an excellent summary of the arsenic and chicken feed issue. And this issue is something that I've been working on with David Wellinga for a long time. In 2004, 2005, David tested fast food and supermarket chicken and found that a majority of it contained arsenic residues. And he published a report, but he really wanted to force the FDA to act. So in 2009, David contacted the Center for Food Safety asking if we were interested in doing something and filing a legal petition, and we were, and we did. So in late 2009, we petitioned the FDA to ban all arsenic-containing animal feed additives. And 4 years later, after both FDA and Johns Hopkins confirmed that there are arsenic residues in chicken that are fed arsenical drugs, and in fact that these residues were inorganic arsenic, which is, as Urvashi explained, a known carcinogen, FDA banned the drugs just last fall, and this was based on pressure from our petition and our subsequent lawsuit. So I just wanted to highlight this as one of the only examples of a harmful animal drug being taken off the market, and it was and it was generated by pressure from consumers and from pressure from public interest organizations. So there's definitely work that can be done on that level. And with that, I think I'll turn it over to Rachel to get to your questions, since we only have a few minutes left.
Thanks so much, Paige. So we have a few different questions here. I'm wondering if Blythe is available to ask her questions. So I'm going to unmute you, Blythe, and you can ask. You had a few questions for Urvashi. If you're available, you can go ahead now. If not, I can read your questions out for you. Okay. We'll leave Blythe unmuted in case she wants to hop in here. But these questions are specifically for Urvashi. And I'm going to unmute you, Urvashi, so you can respond. So her first question was, are you familiar with the SRI method of rice cultivation, and if and how it might reduce the arsenic content of rice?
I'm not specifically familiar with SRI, but just doing a quick Google search, I understand that it's sort of dealing with some of the nutrients, it seems like, in rice farming. Like I say, or sort of mentioned briefly, there are multiple agricultural practices that affect the uptake of arsenic in rice, and it's really interesting to learn what the rice industry is now kind of studying. And it wouldn't surprise me, nutrient content can also affect the uptake of arsenic, and I think as it relates to rice or even orchards, I think that's a really interesting question, and I think it's a great question for USDA and the rice industry to see if they are looking at those things. I hope they would be.
Great. Okay, I'm going to unmute all the presenters so everyone can respond to these questions. The second was, will Consumer Reports investigate arsenic in baby formula?
We did look at arsenic in baby formula. It was not because the formula is rice-based. It's because the formula, some of the formulas can contain rice syrup. And rice syrup is a sweetener that is used not just in infant formulas, but really throughout the natural food industry. And Dartmouth had actually done some studies on rice syrup showing levels of arsenic. What's really interesting, and you should, if you're interested in learning more about that, please do visit our free story online at consumerreports.org. We did actually look at the arsenic levels in one manufacturer who was using who's using rice syrup in his infant formula and had quite high levels. And he, once I think Dartmouth revealed that, he actually started working very hard to source his rice syrup from a better place, and also to look at filtration for rice syrups in processing. And he was actually, we sampled his product multiple times over the course of our testing and did document that he was able to get to lower levels. So that was encouraging and interesting, and you can read more about that online.
Great. This question, I think, was directed towards Ann, and it was, we raise backyard chickens and buy feed from local feed stores. Is this the same feed given to commercial chicken industry, and does it contain any arsenic?
And that's a very good question, and I don't know the answer to it, and I'm wondering Paige or Urvashi might know.
This is Paige. I believe that some of it does contain arsenic. It depends. There was a woman in, I believe it was Utah several years ago, that was feeding her backyard chickens regular feed from the feed store, and she found out that her chickens had, when she slaughtered them, had arsenic residues in them. So it's completely possible. And I'm sure that not all feed does have arsenic in it, but I'm sure that some feed does have arsenic in it. Oh, and I also, sorry, one more thing to add. I should say that these days it's much less likely that the chicken feed does have arsenic in it, because 98 out of 101 arsenic-containing substances have been eliminated from chicken feed. So now it's much less likely.
Great. This next question comes from Lisa Sadler-Hart, and the question is, are there labs that community gardens can send soil samples to for assessment of chemicals? Is that something that the grant will cover?
So there are, many of us rely on our land grant university who have labs. They are often the soil and plant experts, but not all of them are doing tests for environmental contaminants. So when you send a sample, usually they have instructions on how to collect a sample and paperwork you need to fill out to request your testing. What you are looking for is additional tests that are probably not the normal pH, NPK, and organic content or cation exchange. You're also looking for maybe a heavy metal panel or some other kinds of tests that you'll want to do. And really, the way we decide what to test for depends on how the property has been used in the past. So, you might test for lead if you had an older house that the garden abutted. Or if you had used pesticides or knew the property had had pesticide use in the past. That might be how you decide what you would sample for. But we don't always know all of the things that have happened in our homes before we lived there. So I personally just did a metal panel just to see, and I was fine. But I think a whole lot more gardeners need to do it because land-grant universities need to see there's a demand. And if your local government applied for a brownfield grant, which we have both urban and rural communities that can apply for them, then both the looking into the history of the property and actually sampling and doing that analytical work would be covered under the grant for an assessment grant.
This is Art in Lawrence. We use the University of Massachusetts does our testing for us.
So I think we had provided a fact sheet with some examples of different land-grant universities that do testing to David and Rachel, so that might be on the resource links for this webinar. If not, I'm happy to send it to you.
We'll make sure that's up on the resources page.
Great.
We have a follow-up question off of that, I believe. This is from Linda Dix Cooper. I'm a public health researcher in Canada and was wondering if there is federal funding comparable to brownfield grants here.
I know that you have had a very active brownfields program in certain parts of Canada, so I'm not sure if that would be true in your neck of the woods. But I know in Ontario, because I've seen some of their materials. But if you want to get in touch with me, and of course if anybody else does too, I'm your public servant, and you can email me at Carroll, carroll.ann@epa.gov. So I'm happy to answer additional questions that might come to you after this.
Okay, great. So we have a question for Art, and this comes from Lisa Sadler-Hart. What type of funding did you access to create these urban gardens? What did each of your partners contribute to the garden?
Well, to begin with, because of the city has a high level of city-owned vacant lots because of the foreclosure crisis and housing, the poverty and transient population, we only targeted initially small, otherwise undevelopable vacant lots in the poorest part of the city. So we already had the sites. Critical of starting, as I said before, was the Brownfield grant from the EPA because that gave us the ability to test the particular sites we were trying to do and evaluate the risks. We also got a grant from the state Executive Office of Environmental Affairs to build our first round of community gardens. Thereafter, I mentioned the Safe and Successful Youth Initiative. That's an anti-violence grant where we'll be able to use some of our street workers to work with the neighbors in the gardens. We also get money from our Executive Office of Public Health. One of the side benefits of actually organizing with the neighbors is it's much easier then for them to raise private money from local businesses or other philanthropic foundations to be able to maintain some of the gardens. And of course, some of the they eat their own food when they develop the garden. Sometimes they have little farm stands, so they can develop a little bit of extra revenue or at least reduce their outlay for food. So once you've got them going and once you've got the neighbors organized, there's a variety of public and private sources you can patch together, work to do additional gardens and maintain existing ones.
Great. We've got a couple more questions. We don't want to go too far over time, but this one comes from Raya Saeed, and I think this is for Urvashi, specifically about arsenic. And the question is, what is the safe level tolerated in eatable food, and what are the side effects of it?
You know, and this also, I mean, I'm going to roll that up with another question we got to about, you know, Asians eat a lot of rice and how, you know, do they get a lot of cancer, bladder cancer or whatever. This is really tough because there isn't really a safe amount of a carcinogen. When it comes to vulnerable populations and some of these non-cancer effects we're seeing, they're not quantified. So it's hard to really pin yourself on an exact level. What we do know, and what those side effects may be, we do know that arsenic is a carcinogen, and we know that from human population studies and from looking at it over a long time, especially from exposure from water. And this type of arsenic we're seeing in rice or in apple juice is really no different. It's the same form. And I'll also say that even if arsenic comes from a natural source or an unnatural source, whatever it is, once it's in your food, it's in your food. And so if it's inorganic and it's at a certain level, we can do things about quantifying that risk. Overall, none is the best, and less is better. And so that's why our advice really to people is if you reduce your exposure, you should be able to reduce your risk. But if people want to know, you know, is rice cause cancer? No one's done those studies before. Nobody looks at rice consumption and cancer incidence. So the studies simply haven't been done. But from a public health perspective, given what we know, it's really very smart to reduce your exposure to arsenic where you know it might be particularly problematic.
Great. We just have a couple more questions here. One is, which rice varieties are higher in arsenic in general?
Good question. Brown rice, on the whole, will be higher, and the reason for that is because the way arsenic distributes in the rice hull, the outside of the rice gets the most amount of arsenic, and even the inorganic form. That said, I want to just really caution people because obviously brown rice is more nutritious than white rice. And when we did our serving recommendations, we did not differentiate. So if you're a brown rice eater, you should keep on eating brown rice. What we found is when we looked at paired samples of rice from companies that were making the white and the brown, that the white definitely had less than its brown counterpart. That said, we did find, for example, a brown rice in California that had less arsenic than some of the white rices that we were looking at from Texas. So you don't want to say brown will always have more than white because it's really about their counterpart. However, as in understanding how arsenic distributes, the brown form will have more than its white counterpart. The risk consumptions, I'm sorry, the serving sizes are really, like I said, for white or brown. We don't think people should all switch over to white rice. And that's why we think putting standards in place will be really important. Because rice is an important staple in lots of people's diets. And so we do not want people to just switch over from brown to white as a result of this research.
Great. And then we've got, I think we'll just do one last question here. And it comes from Blythe Ross. Are there home tests that average consumers can use to determine the safety of food products that they are consuming?
Not when it comes to heavy metals, I'm afraid. And not when it comes to pathogens either. I don't know, it's a great question. I wish there were something like that.
I would say that's, in part, that's what we fund our federal agencies to do for us.
Right. Well, I think that's the last question. David, if you want to wrap up.
Rachel, can I had one other comment if I could just add it? The major source of funding that we get. Sorry.
Sure.
I forgot to mention, once we have the gardens established and neighborhoods established, a primary source of ongoing money is the Community Development Block Grant Program from HUD. So HUD has been a continuing partner with us in this program, and it's a source most poor cities have.
Great. Thanks, Art. So David, do you want to wrap up? I think I'll go for it. I want to thank you. I want to thank our sponsoring organizations and thank you presenters for your time today. Make sure you're registered for the next food pollution webinar on February 25th, Fish Fats and Toxic Pollutants, focused on mercury advice for clinicians and patients, featuring Dr. Emily Oken of Harvard Medical School. And in March, we feature Dr. Shauna Swan of Mount Sinai Medical Center talking about phthalates and BPA in food packaging. Register at healthyfoodaction.org. Tell friends, colleagues, and family members who are health professionals to join our network and help us grow a powerful national voice calling for healthier, more sustainable food systems. There are links to current policy actions and recordings of past webinars on our website, and a recording of today's webinar will be available as soon as tomorrow. You will get an email with the recording and the slides. Be sure to follow us on Twitter at Healthy Food Action, HFA Action, and at Food Doctor, at food_doctor. You can find us on LinkedIn, Google+, and on Facebook. Please keep your eyes open for our future series of webinars. Later this year, we will be doing one on health disparities and food justice. Until next time, thanks for attending.